Hi, I'm Matt Koffenberg, a physical therapist and owner of Perham Physical Therapy. Today we're going to talk about one common source of knee pain that's called patellofemoral knee pain. So what exactly is patellofemoral knee pain? Well, as the name implies, it includes the patella, which is the kneecap. And then it also includes the femur bone, which is the large thigh bone. So it's really where the kneecap and the thigh bone meet. That's where we can have all sorts of problems. Some characteristics of patellofemoral pain would be that it's kind of like a generalized knee pain. There isn't really one specific place that people will feel the pain. More often than not, it'll start in the front part of the knee, and then often it'll kind of wrap even all the way around to the back side of the knee. Patellofemoral pain is a little more common in women than it is in men. It often will start at a fairly early age. You know, some people in their teens, 15, 16, 17-year-olds can often experience patellofemoral pain. Usually there's really no cause to patellofemoral. I take that back. Usually there's no injury that creates patellofemoral pain. There are several causes, and we'll get into that, but there's really no one injury that creates it. A lot of times people will be very, very active, they don't have pain, and when they stop being active, that's when they start feeling the pain. Probably the one big thing that really tells me that this is patellofemoral pain syndrome is when someone comes into my clinic and says, man, my pain really skyrockets when I have my knee in a bent position for a long time. So, like for example, going to the movie theater and your knee is bent at about 90 degrees as you're watching the movie, and then the knee just starts to throb and ache. Typically that's going to be patellofemoral pain syndrome. So what causes patellofemoral pain syndrome? Well, first let's quickly look at the anatomy of the knee. I've got a knee model, and so as we look at this, we're looking at this from the front. This would be the femur bone, or that thigh bone, and then down here we have our shin bone. And then this particular tendon is called our patella tendon, and underneath that patellar tendon, so if we can peel that away, we can actually see the patella. So the patella sits right on top of the femur. And you can see within the femur that there's a groove within the femur for this patella bone to sit. Now, patellofemoral pain is when that patella or that kneecap does not sit properly inside that groove. So if we look at our drawing, we have basically this is looking at the groove where that patella sits. So the blue here is the patella, the black here is our femur, and here is the groove. This would be a normal environment in which the patella should sit. Over on this side, we have a situation in which this patella or the kneecap is actually shifted one direction. And when that occurs, that's when we have some problems, because the patella will actually bang right into the femur and you'll end up with some pain, or that patellofemoral pain syndrome. So why does that kneecap shift? There are a couple of reasons. Number one, we can have weakness within our stomach muscles and weakness within our hip muscles. So when we walk, our stomach and our hip muscles should contract every time our foot lands. So those muscles should contract, and it keeps our pelvis in a real stable base. If our stomach is slightly weak, or if our hip muscles are slightly weak, when our foot lands, the pelvis will actually shift off to the side. When the pelvis shifts, it causes my thigh bone to actually drive inward. So that would be this picture here. So this is the outside of the knee, this would be the inside of the knee. If I have weakness, my thigh bone drives inward and it causes a shift of the patella to the outside. That's one potential cause. Another cause for the shifting of the patella is if I'm really, really tight. So if I have some tightness on this side of my thigh muscle, combined with some weakness on this side of my thigh muscle, the tightness or the shortness here, as this contracts, this isn't strong enough to stop the kneecap from moving, and the kneecap will actually shift off to the side. The final thing that often causes a shifting of that kneecap is if I have flat feet. So if my foot actually collapses downward, that whole mechanism drives my thigh bone inward, and the kneecap shifts outward again. So physical therapists are well trained at developing an exercise program to counteract all of those potential causes, whether it be stomach weakness, hip weakness, thigh weakness, or thigh tightness, or potentially we need to look at some sort of insert or orthotic for your feet. Please give me a call if you have any knee pain that you might suspect is patellofemoral in nature. I'll be happy to take a look at it. 218-346-2464.
Thank you for watching Wellness for Life.